I'm Dr. Daniel Kraft, founder of Chair of Exponential Medicine, and I'm going to talk a little bit about the future of health and medicine and the convergence of fast-moving technologies that can enable us to rethink and reimagine the future of health and wellness, diagnostics, therapy, and discovery. So a big part of the future of health and medicine is really truly moving to health and prevention and incentivizing hospitals, physicians, nurses, and patients to spend more of their time, energy, and dollar on the preventative side of the equation. Because it's our behaviors over many years that are much more impactful than our genetics, for example, at impacting the health of our individual life and those of society. And we're now in an era where we can start to measure our behaviors. We're in the era of quantified self, wearable devices on our wrists that can track our steps and our sleep. These are sort of simple sensors 1.0. And we're moving, however, from this era of just quantified self that the kind of data geeks like to have as an individual to this idea of quantified health, where I might prescribe a patient a wearable device, a blood pressure cuff, a glucometer, a connected scale, and have that data flow back to me through their smartphone into my medical record to help track, incentivize, and adjust someone's health prevention, diagnostics, and therapy. Diagnosis. I'm an oncologist. All too often we find patients who come to us with stage 3 and 4 cancer. We want to pick up disease early, what I like to call stage 0 medicine. We now have a whole new set of digital tools and digital diagnostics that an individual consumer or patient can have at home, or that a clinician can have in the office or doing telemedicine. There are now medical tricorder devices being developed that you can have as a consumer that will pull down your temperature, your heart rate, your respiratory rate, calculate your blood pressure, integrate that on your smartphone with artificial intelligence to help do triage, understand the trends of data, where it's taking you, and helping you decide and diagnose a disease, not just from the vital signs, but increasingly laboratories that you can have on a stick and use a smartphone to analyze. So the future of diagnostics is going to be globalized, it's going to be local to your home and to your body, and enable us to pick up disease earlier and then treat it in smarter and less expensive ways. We all want our therapy to be much more individualized and tuned to the patient. Doctors today try and practice personalized medicine. But we're going to have a whole new set of tools to truly personalize healthcare, from the $100 genome to leveraging microbiome data, your Internet of Things, and wearable information. When we treat a patient now, we'll have much smarter feedback loops on things like blood pressure, weight, blood levels, and we're going to start to tune therapy based on genetics. Pharmacogenetics, for example, today can enable you as a doctor to figure out what drug and what dose is most appropriate for a patient. So the future of therapy will be more personalized, more precise, more based on the patient's data and feedback loops over time, and give us much better outcomes at lower costs. Today, when a medical discovery is made, it often takes 17 years from publication to becoming standard of care. It still takes often $1 billion in 10 years for a single drug to make it to market, and over 50% fail. What if we could rethink and reimagine the future of clinical trials and discovery? What if every clinician could be plugged into clinical trials? Now, in the advent of smart mobile connected devices, a patient can download a clinical trial for heart disease, for Parkinson's, for asthma. We'll see smart pharma companies blend in the future of discovery, enabling every patient and physician to become a data donor. And just like we crowdsource information when we drive with things like Google Maps and Waze, we'll see the crowdsourcing of clinical trials, the ability to become a data donor. The share button in the hospital or in your medical record will enable us to speed up discovery, from connected devices to downloadable mobile apps to telemedicine. We'll be learning continuously with our hive mind and speeding up the ability to go from discovery to impact for individuals, for healthcare systems, for countries, and for global health around the planet. So the future of health and medicine can be bright if we bring new thinking and a new mindset to health and medicine. Using exponential thinking and the convergence of technologies, from robotics to drones to 3D printing to sensors to artificial intelligence to machine learning, and converge them together in smart new ways aligned with new incentives, we can really shift to a new era, from our sick care era of today with intermittent data and a reactive mindset to a much more participatory future where we use continuous data and we're much more proactive. And we incentivize the individual, the consumer, the patient, the caregiver to rethink and reimagine healthcare across the whole continuum, from diagnostics to prevention to therapy to discovery, to bring us a bright, bold future of health and medicine for all of us across the planet.